Indeed. Mr. Small, senior leaders from VHA participated in the daily coordination meetings hosted by FEMA during the pandemic, and what they found was there was considerable interagency fragmentation, at least early on. In some instances, the bureaucratic process for getting FEMA assignments delayed VA from providing care that was much needed. Now with the pandemic behind us, can you speak to any changes being made to the national framework that will benefit VA's ability to help in local communities even faster?
Thank you, Senator. VA headquarters maintain a consistent coordination and participation in governing bodies, which allows continuous awareness of potential support at the local levels. During emergencies, we provide VA liaison to the National Response Coordination Center, and we are members in good standing of FEMA-led Recovery Support Function Leadership Group and Emergency Support Leadership Groups. This governing body, coupled with continuous partnership with other federal departments and agencies, as well as the National Security Council, provide us an ability to translate local needs into improved policies and practices.
So in your testimony, you know that VA is partnering with DoD to conduct a DoD military, civilian, national defense, medical system interoperability study. That is a mouthful. I trust a lot of lessons from the pandemic and other formal missions will inform this review. Are you able to provide this committee with an update on the timeline for this work's completion?
Yes, Senator. My esteemed colleague, Mr. Derek Jostad, will provide details, sir.
Thank you, Chairman Tester. The MCNIS, if I can, the Military Civilian National Disaster Medical Interoperability Study, is conducted by DoD through the National Center for Disaster Medicine and Public Health, of which VA, there are 5 pilot sites. VA maintains 2 of those pilots, and these are our Federal Coordinating Centers, or our FCCs. The 2 VA FCCs are in Denver and in Omaha. Year 1 of the pilot study was really the study part of it. Years 2 through 5 are implementation. Years 5 and beyond are expansion.
So, are you done?
Just a little bit more.
Keep going.
We have partnered with DoD on this, and yes, we are looking at lessons learned. As a matter of fact, both the current director and the former director have been out to Martinsburg, West Virginia, to walk through our assets.
So you talked about year 1, you talked about years 2 through 5, you talked to years 5 through 10. When was year 1?
It predated me. I want to say it was 2020.
2020. So by 2025, you'll have the first assessments all done and ready for us to review?
DoD is the primary
right,
on
but the assessments DoD is doing with you will be done so that we can review them.
I cannot speak to DoD's timeline.
Oh, damn, neither can I. So, well, okay. We'll keep our eye out for that. Dr. Bulbus, do you oversee pharmaceuticals within HHS?
My small office does not oversee pharmaceuticals.
So could you take this for the record?
Sure.
There are more than 100 high-use pharmaceutical products that are not produced domestically, but they're essential for common diseases like diabetes. These drugs are susceptible to global supply chain disruptions, and those supply chain disruptions occurred during the COVID-19 pandemic. I believe they constitute a national security risk. So can you go back to your people and ask them what is being done in this realm to ensure that those supply chain challenges and disruptions don't occur in the next pandemic, or don't occur in the next natural disaster, or how about just don't occur?
Absolutely. Post-COVID, there is a lot of work on supply chain resilience at the ASPR, the Administration for Strategic Preparedness and Response, and the Food and Drug Administration, and we can come back with a summary of that.
Be great. That same question for the VA. Not only pharmaceuticals, but beyond pharmaceuticals, critical supplies and equipment to help keep VA facilities running and serving veterans. Some of it now is manufactured right here in America because of the pandemic. Is there anything the VA is doing to ensure that we have access to those supplies when we need them?
Yes, Senator. VA follows, comply with the Buy American Act and trade agreements and infrastructure investments and job acts. Additionally, procurement officers interact with industry frequently to educate and inform them that the federal government, VA, must comply with the BAA, TAA, and we are very interested in products that are made in America.
So the last question that I have is that you have volunteer teams called Demps. They play a critical role in the VA's fourth mission. Between COVID-19 pandemic and near continuous use for responding to national and weather disasters across this country, the all-volunteer force is experiencing a high level of burnout. So, Mr. Small, can you update the committee on recent efforts to establish a collection of dedicated, deployment-ready teams? And, yeah.
Yes,
Or maybe,
Senator.
maybe you have a different view on the burnout.
No, I do not, Senator. But before I hand this question out to my esteemed colleague, Derek Joshua, I just would like to reiterate our commitment to conducting realistic national level exercise, permit us to test at our strategic level readiness of the department through engagement of our senior leadership on the complexity associated with emergency environment. Additionally, this continues engagement and exercise of our continuity operations, emergency relocation groups. Our devolution emergency relocation group provides a mechanism for testing and training our communications to the administration and the staff officers. But I will defer to.
I've got that, and that's good work. The question becomes, Senator King brought up an issue with the shooting in Lewiston, Maine, and how you guys were able to respond really quick. You were able to do that, I assume, because you've had a volunteer force ready to go in that region. Is that correct?
Yes, Senator, we do. I would defer to Mr. Jostad. He can provide details on the Demps program. Senator.
So the real question is that these folks are getting used more and more and more. We heard the testimony from Dr. Balbus. We see what's happened in the country from a disaster standpoint, whether it's man-made or nature-made. And if you see burnout as a problem, we heard from Dr. Small. What else is being done so that we make sure we got the people on the ground?
Chairman Tester, indeed, we did stress our Demps system. But I think it's also very important to note that our Demps volunteers have a warrior spirit and a servant's heart. Over the last year, we've added an additional 1,200 volunteers to those ranks. When we look at applying lessons learned from COVID, we have to address our ability to respond to multiple events, whether it's hotspots, whether it's hurricanes, whether it's mass shootings or wildfires. The CDT program, the Clinical Deployment Team Program, was funded in January of last year, $85 million, to hire 360 clinicians, 20 per vision, 5 doctors, 11 nurses, 2 social workers, and 2 LPNs. As a function of this cohort of FTE, they are eligible, or they are scheduled for possible deployment of 30 days twice a year. That's under the auspices of OEM. So every month I will have 60 providers ready to deploy in under 72 hours. This is a complementary program to the 12,000 Demps volunteers that are still active within our rosters.
Okay, you're talking nationwide figures, right?
Yes.
Yeah, so the question becomes, in a more sparsely populated state like Maine or Montana, it worked in Maine. Do you feel that confident throughout the rest of the United States as far as availability of volunteer manpower?
Volunteer manpower, yes.
Okay. I lied. I got one more question. You got a cash program that was established after 9/11 because of what transpired on 9/11. We're 2 decades since 9/11. Things have changed significantly. Can you speak to what you're doing to revisit the contents of those caches to make sure that they reflect our environment today? Go ahead.
Chairman Tester, I can. The cash program is managed by three separate program offices. The
Yeah.
Office of Public Health, Emergency Pharmacy Services,
Yeah.
and the Office of Emergency Management.
Now, how often are you revisiting them, and are they being changed to reflect the challenges of today?
We meet as co-chairs quarterly
Okay.
to review inspections.
Yeah.
We are also a standing member on the Public Health Emergency Medical Countermeasures Enterprise hosted by HHS.
And are the contents of those caches being changed? Have they changed significantly? Have they changed at all since 9/11?
Actually, the FEMC, or Public Health Emergency Medical Countermeasures Enterprise, works in conjunction with the CDC
Gotcha.
to do an annual report on terms of what we see as threats, what the SNS, or Strategic National Stockpile, has, and how the all hazards emergency cache should complement that.
Okay.
So yes, we do make adjustments within the inventory.
Within the inventory to reflect, okay, good enough. Senator Blumenthal.